Interesting medical facts part 16. Melanoma is a type of skin cancer that can spread anywhere. This can literally go from your skin to your brain to your lungs to your liver and so on. And what's interesting is if you catch melanoma early enough, you do something called a sentinel lymph node biopsy, which is where you check a lymph node near the primary spot of the melanoma to see if that melanoma has spread to that lymph node. But here's a weird thing that happens in melanoma that doesn't always happen in other cancers. So if the melanoma spreads from the primary spot to the lymph node, if that spread in the lymph node is very small, you don't even need to remove the lymph node, because studies have shown that you can just observe that lymph node. You can remove the primary melanoma spot, but it's better to actually just do serial scans of that lymph node with an ultrasound to make sure that it's not getting worse, as opposed to just removing that lymph node right away. And a patient might say, no, I don't want this remnant melanoma in this lymph node. You took out the melanoma itself, the spot, the primary spot. Why not just take out the lymph node? And the reasoning is, if you take out that lymph node, you can actually cause something called lymphedema, which is swelling in that lymph area, which can cause more symptoms later on. So if it's a melanoma spot in the lymph node that's not going to grow, and you can just monitor with ultrasounds over time, that's probably the route to go.